Hi guys, welcome to my YouTube channel. I am Denmark Aranas, a postgraduate medical intern. I basically provide informative videos to medical students. And also, I would like to give aspiring Filipino physicians an idea of what a med student usually tackle in med school. If you find these videos helpful, please don't forget to hit the like button and subscribe to my channel and click the notification bell to be updated for my new videos that I'll be uploading every week. For today, I'll be discussing the clinicopathologic correlation of tuberculosis. This is a disease caused by a bacterium, Mycobacterium tuberculosis. The bacteria usually attacks the lungs, but it could also attack other parts of the body like the kidney, spine, and even the brain. But not everyone infected with TB bacteria becomes sick. As a result, two conditions could exist: latent TB infection and TB disease. If not treated properly, TB disease can be fatal. This is a very common infectious disease that we encounter in the hospital. And this is very important to discuss because our government is trying its best to eradicate this uh, chronic disease. I would like to shout out to David Timothy Villanueva for helping me creating this CPC. We'll be discussing each of his sections one by one. So let's start. Here are the important risk factors that we have to consider: the advanced age, exposure to TB patients, the immunocompromised state, the HIV and AIDS. Recent studies have shown that there is a co-infection of it with TB. Okay, so it is very important to screen patients with AIDS uh, with TB. Okay, we have to check if their cough is related to TB. Other important risk factor would be the diabetes and chronic smoking. All of this would predispose the patient to increased likelihood of acquisition of the Mycobacterium. And this is usually transmitted through a droplet nuclei spread by sneezing and coughing of an infected patient. And that would be inhaled by a healthy person. And that bacterium would now be uh, traveling to the bronchi, and that would activate alveolar macrophages in the lungs, which would trigger an inflammatory response and phagocytosis. The inflammatory response would activate the complementary system, releasing cytokines such as interleukin 1, interleukin 6, tumor necrosis factor, and others. This would manifest as anorexia, fever. And as for TB, this is characterized as afternoon fever. And when that lyses at night, it would manifest as night sweats. And also, it could lead to weight loss, easy fatigability, and cough, as the C fibers are stimulated. As for phagocytosis, the bacterium has a lipoglycan lipoarabinomannan. This is responsible for the inhibition of intracellular calcium release, which would inhibit also the calcium calmodulin pathway, thereby also inhibiting the phagosome-lysosome fusion, thus causing the bacteria phagosome to survive, and it would lead to immune evasion, which would now allow the bacteria to replicate. And once the bacteria replicates to a greater number, it would lead to the rupture of macrophage, and the bacillary contents would be released to the dendritic cells, which would then lead to the lymph nodes. The infection in the lymph nodes would manifest as lymphadenopathy, and through the lymph nodes, it would travel to the central venous return and into the systemic circulation, and it would travel to other parts of the body, which would manifest as extrapulmonary TB. It could go to the kidney, the spine, and even the brain. And as for the lungs, the primary TB infection, the presentation of antigen to T cells would trigger the activation of macrophages combined with the delayed hypersensitivity reaction to it would lead to the caseous necrosis, characteristic of TB infection. And also the bronchial walls and blood vessels would be damaged, which would lead to cavities and fibrosis in the lungs. This would lead to the manifestation of hemoptysis, decreased oxygenation, crackles, wheezes, and decreased breath sounds, and even pleuritic chest pain. Combining the two manifestations would lead to anorexia. And because of the infection with this bacteria, it would lead to a decreased nutrient utilization, further aggravating the weight loss. And a classic picture of a patient infected with TB would be cachexia. Okay, so patients with a chronic cough and uh, cachectic, that is a classic picture of TB. And this now is my reference, the 20th edition Harrison's Principles of Internal Medicine. I would like to leave you with this message. Doctors endure a lot of hardships, and they willingly sacrifice their lives for their patients. They do not deserve any form of shaming. Thank you for listening and have a good day.